Now we'll see what is meant by catamenial epilepsy. Catamenial epilepsy means in certain epileptic women, frequency of seizure is increased during the menstrual period or during menses, and that is called as the catamenial epilepsy. What is catamenial epilepsy? In certain epileptic women, means known case of epilepsy. In women, there is a known case of epilepsy or epileptic attacks. Their frequency of seizures is increased during that particular period, during menstrual period or during first 5 days of menses, and that is called as the catamenial epilepsy. That is called as the catamenial epilepsy. Now, what are the causative factors or etiology behind that catamenial epilepsy is the hormonal changes, because we know that estrogen is a pro-epileptic, it can cause epileptic attacks. Progesterone is anti-epileptic, and there is an alteration in the plasma protein binding during menses. There is an alteration in the plasma protein binding. So if there is an alteration in the plasma protein binding, so there is a reduced plasma concentration of the anti-epileptic drugs. So all these are the reasons for the catamenial epilepsy, we can say that. So what treatment you can give? Acetazolamide, carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor, you can start 250 to 500 milligram per day, or maximum you can give 1000 milligram per day, and it is given before the expected onset of menses and continue till menses to prevent the attacks of the catamenial epilepsy. Acetazolamide 250 to 500 milligram per day, or you can give up to 1000 milligram per day, and it is started before the expected onset of menses and it is continued till the menses. So this is the one drug that we can use, acetazolamide. You can give the administration of the progesterone, because progesterone is an anti-epileptic action, so you can give the progesterone, or you can use the oral contraceptive pills to regulate the menses. For the regulation of menses, you can use the oral contraceptive pills so that it will regulate your menses. Increase the dose of anti-epileptic drug. Whatever drug that has been already chosen as an anti-epileptic drug, you have to increase the dose, because there is a alteration in the plasma protein binding, so there is a reduced plasma concentration of the anti-epileptic drug. So you can increase the dose of anti-epileptic drug, or you can also use the ganaxolone. Ganaxolone is nothing but the synthetic analog of the progesterone, synthetic analog of the neuroactive steroid pregnenolone. It's a ganaxolone you can use, because we know that progesterone has anti-epileptic property. So we can use these drugs for the catamenial epilepsy. What is catamenial epilepsy? It's a frequency of seizure is increased during menses in certain epileptic women. So we can prevent this catamenial epilepsy by using these drugs. That's all.